Hello, my name is Scott Ackerman. I'm a radiation oncologist here in Jacksonville, Florida. And I see all kinds of patients with cancer, all kinds of cancers. And one type of cancer I see a lot is head and neck cancer. So head and neck cancer is that group of cancers that are confined to the upper aerodigestive tract, meaning the mouth, the nasopharynx, the pharynx, the throat. Throat cancer, that's head and neck cancer. And patients ask me, are there any new treatments for head and neck cancer? What is new in the way you treat head and neck cancer? And I get questions a lot from other physicians, a lot of the ENTs in town I work with, and we talk about the different advances in the treatment of head and neck cancer. And the main advance in the treatment of head and neck cancer is really identifying those patients that don't need to have aggressive surgery, but could be better treated with radiation, perhaps even with chemotherapy, in order to preserve the function and form of their throat and their jaw. And the way we deliver the radiation treatments is interesting, and that there's been advances in how we give the radiation therapy treatments. In certain head and neck cancers, we have found that by doing radiation therapy treatments twice a day instead of once a day, we can get a higher level of tumor control and less long-term side effects. So in certain advanced head and neck cancers, we treat these patients twice a day. Generally, when you come for radiation therapy treatments, you come every day, Monday through Friday, 5 days a week, for about 6 weeks. But sometimes with head and neck cancers, it's twice a day for those 6 weeks. Also, we do what's called image-guided radiotherapy. So we want to be very precise in the way we deliver the dose of radiation. And so we want to make sure the patient is set up very precisely every day. And we have these laser marks that we use, that we put on this in this mask that a patient puts on that holds them in the right position. But before we do a treatment, we take a couple x-ray pictures and we see where the patient's lined up. And then we move the patient and we're able to get them lined up within a millimeter of where they need to be, so we could target the tumor very, very precisely. And by being able to target the tumor very precisely, we can give less radiation to the normal structures. And in the mouth, in the head and neck, there's lots of normal structures that are very sensitive to radiation. The spit glands, for instance, the throat, the brainstem, the eyes, those things are all very sensitive to radiation, and we want to try to avoid at all costs excessive dose of radiation to those structures. So image-guided radiotherapy allows us to do that.
For more information on this type of cancer or any other cancers, please call Dr. Scott Ackerman at First Coast Oncology, 904-880-5522, or visit us on the web at www.firstcoastoncology.com.